Today it's given by Dr. Norbert Pfleger, Managing Director of semvox, from assistants to AI companions. Okay, welcome to stage.
Thank you. Welcome. My name is Norbert. I'm CEO of semvox. Semvox is a software company. Actually, we are also a spin-off of DFGI, founded in 2008, and we are actually dealing with AI assistance technology. 90% of our business is in the automotive industry, but we are also providing our tool chain to medical application, industry, industrial applications, and things like that. My topic today is from assistants to AI companions, and I'd like to switch focus a little bit on the topic of user experience. So we heard today a lot about agentic AI, about AI assistance, and things that we can do in medtech applications, in medical applications. And I'd like to take a slightly different view on how we can improve with an advanced idea or an advanced vision of an AI assistant, the overall workflow, the overall user experience. So classical AI assistants today require the user to understand and to control the application. I believe everyone experienced that. So you have to pose the correct commands, or at least to understand which functions are supported by the system. And at the end, you get pretty good results if you know what the system is capable of. We would like to turn that a little bit around, coming up with new user interfaces, which we call AI companions, that are actually getting a little bit more information about the user, that are capable of adapting to the user to build up a rich set of contextual information about the user, and that are capable of engaging in a proactive way with the user. And this is what I want to talk about. And at the end, our goal is really to change the way of communication with technology and to actually streamline workflows. So what we here see is a reduced form of the stakeholders that we see in a typical hospital. Yeah? But you can also adapt this idea to other areas of applications in medtech. But we have on the left side the patient, we have the nursing staff, we have the doctors, and we have also the relatives. And all they want to get informed properly, they want to do their jobs, they want to get treated in the best way. And we have a lot of back-end systems that are involved here, like the operating room, we have IT systems, we have an electronic health record, we have the hospital information system, and so on. There are multiple information sources which we would like to connect. And the overall goal here really is to bring in a interaction flow that helps the user understanding, helps the user to fill in the gaps, and that's something we just heard in the previous talk also with surgeons that have to remember a lot of information, that have to take decisions under pretty complicated situations. And here this idea of a companion kicks in. The companion actually is capable of engaging in an empathic way with the user. The companion is capable of supporting the user in a proactive way. And at the end we get three big benefits. First, the clinical workflows get better, which means we have less manual work, we have faster responses and smoother processes. Second, patients feel more engaged, especially when they get addressed in a personalized, in an empathic way. They're not just by a standard user interface asking standard questions and giving standard responses. And third, we can support for deep system integration that not only integrates the system listed on the right side here of this picture, but also a lot of additional context information, additional services, internet-based services, maybe also personal services like music services, infotainment aspects as well. So at the end, everything gets linked, yeah, and everything gets combined for a optimized user experience. And I would like to give you a brief idea of how this could look like. So I brought with me a real-life use case. Imagine a patient recovering after surgery. He feels uncertain, he feels maybe has some pain, and needs especially some kind of reassurance. Yeah? And here is where our AI companion, we call it Clara, kicks in. Yeah? And at the end, she is capable of asking questions of really engaging with the user, and also giving feedback on what the user actually said. So here we have maybe a morning briefing where Clara asks how the user is feeling after the night, and he's willing, or he's agreeing to answer some questions. Yeah. So first of all, she's asking about his condition compared to yesterday. He's giving the feedback that he's feeling a little bit weaker, and the interaction goes on. And what is important here is that it's not just going on in a standard template, but it's really adapting to the feedback of the user. So she's really coming back with, I'm really sorry to hear that. Pain can be very draining, especially after surgery, and so on. And this is where we really can get a new level of interaction, where we really can also get users giving feedback in a more detailed way or in a more open way. And at the end, she's collecting the data that she needs, and is then capable of combining all that information, and if needed, in this case it is needed, she can inform the medical staff so that proper action can be taken. Yeah? So this is some way the interaction can go on. Sorry, that was a little bit too fast, but going back here, it's not working, so going back is not possible. Sorry for that. I've just a brief other example that's also going the same direction. For example, someone calling for a nurse, lying in the bed, calling for a nurse. The typical workflow is the nursing staff is walking to the room of the patients, asking what's the matter, maybe getting information that the patient has some headache or something like that, going back to the nurse station, picking up some water, picking up some painkillers, coming back to the patient's room, and so on. Wouldn't it be way more efficient if Clara is taking this information beforehand, informing directly the nursing staff with this information, and we can save a lot of time. So one very important aspect is here, what we've seen in the beginning with this picture where the AI companion is in the middle between the primary stakeholders in a medical workflow. The AI assistant is capable of transferring the information between the different variations, between the different roads, yeah? And so making sure that there is an optimized information flow between all parties. And to quickly summarize on a technical level, how is this possible? So we talked about the difference between AI assistants and companions. So on the left side here, we have the traditional assistants. They are more reactive, typically, or quite often they are rule-based. These days they're getting also LLM-based, agentic-based, but they focus on the basic task automation. Yeah? They're doing things they are told to do. With this transformation to AI companions, we bring in a proactive way of interaction where the assistant is taking initiative. We bring an adaptable user interface that is capable of engaging in an empathic way with the users. Of course, we are supporting multimodal interaction where we are capable of taking into account, for example, facial expressions, gestures by the users, and so on. And at the end, we have a conversational system that integrates multiple backend systems, that integrates a huge set of contextual information, and by this we are capable of enhancing clinical workflows, improve patient engagement, and support the accessibility to technology. And this is, and exactly right now my time is up, what our AI companions are about. Thank you very much.
Yeah, thank you very much for the talk today. It was a very fitting closure to the session on companions. So thank you all for participating also in this fascinating session. Thanks again to all the speakers and participants, and have a good lunch break.